I would like to introduce you all to my Uncle David. Here is a picture of him graduating from high school in 1978. David was 6 feet tall and had these long arms that would flop around when he walked. He spent hours a day walking in our suburban neighborhood in Portland, Oregon. He loved chatting with neighbors and checking up on everyone's yards. He was active in his church, including volunteering in the children's Sunday school. He told the best, but really the worst, corny jokes. David also had an intellectual and developmental disability. His walking was a little unsteady, his speech slurred, and he took longer to understand complex information. He had epilepsy and sometimes was hospitalized after being injured during a seizure. Watching David receive medical care is where I first learned how important it is to see a patient's disability rather than just their diagnosis. During one hospitalization, David needed a temporary tube in his neck to help him breathe on his own. This prevented him from speaking. When I went to the hospital to visit him, I was shocked to find him tied down with his hands in restraints and the nurse call button nowhere within his reach. I went straight to the nurse's station and asked, "Could you tell me why David's hands are restrained?" The nurse replied, "David has an intellectual disability. He might try to pull the tube from his neck. He could hurt himself or someone else." David had never acted out or hurt anyone while hospitalized. I said, "But how can he contact you if he is in pain or if he needs anything?" The nurse said, "Again, with David's intellectual disability, he can't use a call button or communicate. Why would he need to contact a nurse?" I asked the nurse to come back with me to David's room. With his hands in restraints, I had him put his left thumb up for yes and right thumb up for no. I quizzed him about the date, the president, and other general questions. He was 100% correct. David's medical chart listed his diagnoses: intellectual disability and epilepsy. Nowhere was information about how this impacted his life or functioning. It also did not have information about the supports he needed to participate in his care. If, instead of being tied down, he was given access to a whiteboard and marker, he could have fully communicated with his healthcare team. When healthcare teams don't have information about patients' disability, research shows that they can make assumptions about the abilities, quality of life, and contributions of patients with disabilities. This can lead to misinformed decisions. During another one of David's hospitalizations, his team assumed he could not use the toilet, and so he was put in adult diapers for his entire hospital stay. I am a speech-language pathologist and a PhD trained researcher studying how to improve the quality of care of patients with disabilities. My Uncle David inspires and motivates this work. In the United States, approximately 27% of adults have a disability. This number often surprises people, which is why scholars and advocates often describe them as the invisible minority. People with disabilities are our friends, our family, and at some point could be any of us. By not being seen, the value and contributions of patients with disabilities often go unrecognized. This can extend into healthcare. In the early 1900s, prominent medical minds championed the eugenics movement, believing that to improve society, certain genes should be encouraged while other genes should be discouraged. Many people with disabilities were considered to have bad genes. Under the guise of improving society, states institutionalized hundreds of thousands and forcibly sterilized over 70,000 people. Negative assumptions about patients with disabilities can still affect their care today. At the start of the COVID-19 pandemic, 7 states had rationing plans that deprioritize patients with certain disabilities, like David, from receiving medical treatment. While these plans were deemed illegal, there were still documented events of disabled people not receiving treatment because their healthcare team explicitly stated that their life was not worth continuing. On December 23, 2016, David was admitted to the hospital again. He had pneumonia. He was weak, having difficulty walking and talking, and was unable to eat or drink. After a few days of antibiotics, the pneumonia cleared, and so his team wanted to send David home. The problem was that while his swallowing improved, he could not yet safely eat or drink. The doctor, my father, and I reviewed options for how David could receive nutrition while he regained his strength. Based off of my years of experience working with patients with swallowing problems, I suggested a common treatment for this type of situation. A tiny tube that would go through his nose and into his stomach called a nasogastric, or an NG tube, which David had received in the past. The doctor shook his head. He said it would be cruel to give someone with David's disability an NG tube, as it was uncomfortable. Instead, he recommended hospice. How can we help medical teams see patients with disabilities rather than just their diagnoses? It's a complicated problem, but the first step is simple. Ask patients about any disability and document the information in their medical chart. Disability could be collected through an intake form, a verbal question, or through the patient portal. Documenting disability allows healthcare organizations to identify gaps and take steps to improve the quality of their care for their patients. Women with disabilities have significantly lower rates of mammograms for reasons including lack of access to any accessible radiology machine. Documenting disability also allows healthcare teams to identify patients who require supports, also called accommodations. These are not only legally mandated, but help teams provide the best care. Again, a simple accommodation, such as a whiteboard and marker, would have allowed David to participate in conversations about his care. My team and I conducted a study training staff at 53 primary care clinics in Colorado. Thousands of patients were asked, due to a disability, do you need any accommodations or supports during your visit? If a patient said yes, there are 6 additional questions that asked about hearing, vision, cognition, mobility, communication, and ability to bathe or dress themselves. The clinics did not receive a single complaint from patients about the questions, which barely added a few seconds to the calls. But we did have one problem. Despite training, some staff still expressed discomfort and thought it inappropriate to ask patients about their disability. It is these feelings are what continue to keep disability invisible. After the tense conversation with David's doctors, we went home for the night, believing that he would receive the NG tube the next day. We called the hospital in the morning and were stunned to learn that David had been discharged to a nursing home without the NG tube, and with instructions he could eat a regular meal. Within a day, the pneumonia returned, and David's health rapidly declined. He was in and out of consciousness, struggling to breathe, sicker than he was before. On December 31st, I sat with my Uncle David in his final moments, clearing the excess mucus streaming from his mouth, helping him breathe just a bit more easily. As the year ended, so did his life. He was 56 years old. I began the new year going through David's belongings and discovered a stack of brightly colored, handwritten get well cards from the children in his Sunday school class. In the cards were messages and notes about how much he meant to them. If David's medical chart reflected the notes and the messages in those cards, his team might have better understood the value and contributions of his life, potentially making a difference in his care. For the millions of people with a disability, we have the opportunity to significantly improve the quality of their care and ultimately their lives by creating systems that document patients' disability. We can all be seen. Thank you very much.